and he has a pain located in the lumbar sacral area, radiating down the, which leg was
Right side.
the right side.
Yeah, right
So
side.
so when you came to me, give me a little bit of history on what has happened to you and how long it's been going on.
Sure, it's been going on for just about a year. I'm very active, go to a gym, a fitness center with these high intensity workouts. I haven't worked out in 6 months. I haven't been able to really do much at all. The pain's constant, 24/7.
How much sleep would you get at night usually?
Unfortunately, not a lot until I took stuff to help me sleep. I mean, I literally would have to take muscle relaxers or something to allow me to sleep, and I'd get up, I'd sit up in pain.
Yeah, and you never liked the narcotics, so you never took
No,
narcotics?
I'm not the drug person. I would do Tylenol, but nothing really alleviated this pain.
So what was the level of the pain in your
It's
lower?
a 9 out of 10.
Okay.
And it gradually grew. It didn't start as a 9. It started getting worse to the point where I was not doing much.
Did you have any of the surgeons suggest that you needed surgery?
Oh yeah, after my last consult where they did the nerve block and then a diagnostic needle into my spine, after that they said, well, you're a really good candidate for surgery if this doesn't work.
If that was a nerve conduction study?
That was they did the nerve conduction study, and then they said, okay, we need to do another study where we put numbing fluid into your spine.
Got it.
That was the one that was extremely painful. And afterwards they said, you're a really good candidate for surgery.
Okay. So on Monday, you had your first treatment.
Correct.
So tell us what happened after the first treatment.
And I'll start with, I was a bit of a skeptic. Because I've been to so many doctors and nothing alleviated the pain. I thought, no. I had met with you. I had the first treatment. I got off the table. I was able to touch my toes. I think I showed you that. The pain was gone. It went from a 9 to a 2. Within a 4-minute, however long I was even in there, I don't even know. It went from literally from a 9 all the way down to like a 4, 3, 2. The fact that I could stand, touch my toes. This morning I did yoga.
Why don't you stand up and show them what you're...
Yeah.
So before, when you came in, you couldn't touch your toes?
Before I would walk like this.
Okay.
Because the pain was just debilitating right here.
Right.
I was unable to do this. I could do these touchdowns again. All these things that I was just unable to do. I mean, I could not do that at all. It is gone by 95%, the pain.
And now today, you've had the third treatment as of today.
Treatment, correct.
Right. And of course, it improved so much the first time.
I was a skeptic, and when I left, I think I called every single person I know that has had, lumbar spine issues and referred them in. I know a few have already come in. I am a full believer. I can't believe it worked. Not that I don't believe you, but because I've become a pincushion for the other doctors.
Yeah.
They kept poking and prodding and sticking me, and nothing worked. So this is truly remarkable.
Completed in his back area, and before he had terrible pain, very, very difficult for him to walk, and now he's trying to take his first couple steps. Wait, you're getting ahead of me.
Moving faster.
Definitely moving faster. Yeah. And definitely not as...
About half the pain.
Huh?
About half.
Half?
Half the pain.
And that's just treatment number 1. There we go. That's after the first treatment. And what would you say the pain level is? Why don't we stop right there?
If you get
About a 5 or 6.
Okay, and before...
But it was like a 9, 10, and can't get him in a wheelchair.
Yeah.
It is here if you want it.
And this is and this terrible pain has been going on for how long?
Months.
Over a year.
Wow. Well, it's definitely better. There's no doubt about that.
I can pivot on my own feet.
Well,
I can
you
lift
can
my
do the
leg
dance.
and move. Wow.
Into dancing now. Not yet.
And that's just, I mean, just think of this. This is only treatment number 1.
Hands on your hips even.
Well, I'm really happy for you.
So much better.
Well, that is
I don't want to stop because I'm afraid it's going to go away.
No, it won't. It will be there. He finished his treatments for his arthritis to his hip and to his back, and this is the way he walks now after 6 fractions to the back and 2 fractions to the hip. And you would say that your pain level is?
About a 3, 2
About
or
a-
3. I can give it a 2.
Okay, so it's getting better and better every day.
Better and better every time I come in here to see you.
Okay. Hi, this is Dr. Hesselgesser, and she just had her first treatment to her lower back for radiculopathy. And when you first started the treatment, before we started, you had trouble lifting your left leg?
Yeah, my left leg, it's weak.
It's weak,
It was
okay.
weak.
And so you had your first treatment today. What exactly did you experience under
Oh,
the...
I had no pain.
Yeah?
I felt completely laying back on the table, and I just didn't notice any kind of pain whatsoever. And when I got to get up, I noticed the right side, it just came right up. Look at me. It's just lifting right up. And I usually have to pick it up with my hands. This is amazing. And like if I walk, could I
Yeah.
walk around a little?
Yeah, sure.
So like when I get up to walk, it's like I'm just walking normal. Just normal. No kind of problem. No nothing.
And was your left foot dragging a little bit?
Yes, yes.
So
when I
you-
walked here, it would go like this, like that.
Yeah. So
And
you had kind of like a little bit of a foot drop.
yes,
Yeah.
yes. Now it's just walking, just like a Chihuahua. Yeah, and I can probably start dancing. Look at that. So I'm
So-
very happy, and thanks to Doctor, I'm just, oh my God, blown away,
Yeah, great.
blown
Thank you.
away.
Okay. So you had 3 treatments to your lumbar sacral area, okay?
Yes.
Which was very painful and had
Yes.
been present for how long?
Oh my God, what, 10 years?
10 years,
At
okay.
least.
And the last 2-3 years, really terrible.
Oh yeah.
Yeah.
Especially going down this leg with the sciatica as well.
And you even had a foot drop.
Yes, I had the foot drop too.
Yeah, yeah.
Sure did.
And so you had these 3 treatments. Now you haven't completed all of them yet. You got 6 total, so you have 3 more to go.
Yes.
So far, give me an idea of what your pain level is like.
Right now, I'm so amazed. It's like maybe a 2.
Okay. And you're able to walk normal. Can you get up and walk for me
Oh,
just a
yes.
second here? Okay.
And I'm walking faster than I have, and look at me. Whoa, I'm so excited. I feel fantastic. I feel like a 16-year-old girl. Wow, I do.
Okay, so that really is amazing when you think about it.
I feel amazing. And doctor, you are amazing for bringing this to us to help us, because this was really my last hope.
Yeah.
And I was telling my husband, I said, you know, this is really the last type of treatment that I felt like I could get that
Right.
was so innovative.
Tell me that you had talked to neurologists, neurosurgeons, I imagine.
Yes.
Did you talk to any orthopedic back surgeons?
I did, yeah. He's a sweetheart.
Yeah.
And he did do the injections, and they didn't work.
Yeah. So
Still,
you had
the
it.
leg was sore and painful and cramping and killer cramps,
Yeah.
not just a little. They were bad,
Yeah.
waking me up in the night. And now I'm having to say, to the grace of God, they're gone. They're gone. I just feel like this is God's gift for me.
Yeah.
And you, doctor, your staff, everybody is just amazing.
just completed her treatment to the lumbar sacral spine. And tell us a little quick history of what you felt like the first time you came.
Oh my gosh, I could not walk. This is the God honest truth. Everything I say is the truth. I couldn't walk well. I couldn't stand up straight. My legs hurt. I was taking baby steps. I felt like fatigue, like a big truck hit me. And I was a mess, a total mess.
And you had this lower back pain, sacral pain, so to speak, going down your leg. And which leg was the worst?
It was the left leg that was the worst one.
And you had a little bit of a foot drop on that leg, too.
Yes.
And this had been present for
10 years
10
at
years,
least, yeah.
at least, okay. And you tried multiple things.
I tried exercising where you pull the foot back. I went to chiropractors. I went to back doctors. I virtually did everything. I took nerve pills. You name it, I did it.
And you had shots in the back to try and alleviate the pain, epidural
Yes.
shots, yeah. Cortisone shots at all?
Yes, cortisone, which
Yeah.
I don't like,
Yeah.
but I did it, and
Yeah.
they did not work.
Did not work. And when you came here, I talked to you about using radiation for treating your back, and you subsequently have received 6 fractions of treatment to the back area. You completed it today.
Yes.
So can you get up and walk around here?
Sure.
Just as a demonstration.
Yes, I'd love to get up and walk. Oh, yes, look at me. I mean, I'm going and I'm jumping. I've never jumped that much since 10 years, 15 years ago.
Okay.
And this is amazing. I feel absolutely amazing. I think everybody should just get out and do that. Doctor, you are the best, and I love you.
Okay, thank you.
Gosh.
Sit down. All right, so we completed the treatment to the back area.
Yes.
I'm not sure I want you to jump up and down like that so very
I
often.
feel so alive. You know what? It's almost like my body. I haven't wanted to jump like that. And it's like I'm just wanting to jump.
Did you have trouble touching your toes, by the way, at the time? when
Yeah,
you-
at the time I did.
Yeah.
And you want me to try to
Sure,
touch my toes?
yeah.
Okay. Look at that.
Yeah. Yeah. So
This is
that-
amazing.
And you had numbness of the left foot, and that's all gone?
The numbness is a little bit right here.
Right there,
That's
okay.
still a little bit here. But for the most part, I could actually move my toes, and I don't have to be afraid of them cramping up.
Okay. And also you were getting cramps at nighttime too, right? All that disappeared?
Lots of cramps waking me up in the middle of the morning.
Okay.
I don't get those anymore. And I'm like, is this going to stay like this? I'm praying to God that it does.
Right. And were you on gabapentin?
Yes.
And that didn't really help that much. So you were able to get off of that?
I'm off of them so far.
okay.
And I'm hoping that it never comes back.
Okay, great. She had serious pain in her left knee, okay, and she also had a replaced right knee. So at the time, we talked about the use of radiation. And tell me, if you could, in your own words, what happened after the first couple treatments.
It was great. All my pain, almost all my pain, was gone from the knee that was looking forward to having to have a replacement. And I tried to do everything not to go through another replacement since I've been through one. And this was great. I now can get up, I can walk, I don't have pain. It's wonderful.
So it was such a good relief that you looked at your right knee,
Right.
which had a replacement, and that had some issues.
Yes, the replacements are not perfect, and they're not going to be like an original knee. And I had robotic surgery, so everything was in line. It was perfect. It was lovely, but I had some residual pains, and it was uncomfortable. And now we're getting treatment on that knee, and it's great. I'm very, very pleased.
So if you started off in the first place with your left knee, what level of pain were you having in the left knee when you first
10.
started?
It
10.
was a constant pain, getting up, sitting down, and everything, in every aspect of my life.
So your quality of mobility was way down
Way down.
based on that.
Yes.
And what would you put yourself on the left knee now? What's your level of pain now?
1 or half of 1.
And the quality of your mobility and all that?
It's great. I no longer need to use a cane all the time or hold on to someone's arm all the time, where I did have to before.
You can go up and down steps?
I go up and down steps. I still do the old people kind of steps. I do one at a time, and I think it's now habit from having so much pain.
Got it.
But yes, I can go up and down steps. I can do everything.
So on a satisfaction level of 1 to 10, 10 being the highest, you would say on the left leg you are?
The most satisfied at 10.
Okay. And on the level of the, now let's go to the right knee, on the pain level, what was the pain level on the right knee?
The pain level wasn't a lot.
So
But
maybe a 3, 4?
Oh, it was, yeah, about 3, 4.
Okay. And
now-
after treatment with
And
it?
I've only had 2 treatments. I think today maybe was the 3rd, and it's gone down considerably, maybe 1.
Okay. So you're very
It's still a little
satisfied.
tender to the touch in the one area.
Okay. So you're very satisfied with that too?
I'm very satisfied with the entire system, treatment. It's a godsend.
And the treatment itself was painless and it took...
Oh, absolutely. Quick,
Quick.
fast. Everyone is polite. It's wonderful.
Okay. Thank you very much.
Thank you.
How many things did you try on your knee?
Well, once I tore the meniscus, I did the surgery, and then I forgot what the first shot was that he gave me. It didn't seem to work. And then he tried cortisone twice, and it didn't seem to work. The pain was still there. Now the cortisone seemed to work on my shoulder, but it didn't on my knee. This is the only thing that's really worked on my knee. Nothing
Okay.
else has ever.
And so how long ago did you have your surgery on your knee for the meniscus, torn meniscus?
I don't know, 2014 maybe?
So over
2016.
5 years, 6, 7 years ago. And
Close to
you've
that,
been,
yeah.
since that surgery, you've had that continual pain in that knee.
Yeah, I would limp. I couldn't walk stairs without, bracing myself for each step. I walked slower, and before that, my wife used to have trouble catching up to me every time we would walk somewhere. And then she goes, "I know you're in pain because you can't keep up with me." Now we're back to kind of, when we walk, we can walk together.
She's being evaluated for treatment to her knees, and so she's going to walk up and down, and that's how she walks today. She has a little bit of a foot drop too, but and that's mainly on the left side or right side actually. Well, yeah, okay, and the knee that hurts you the most is which knee? Is
Left.
the left knee.
Yes.
Okay, all right. Wow.
Good.
And
Very good.
very good.
Very good.
Very good. All right. Wonderful.
Oh,
Never.
wow. Thank you, doctor.
You're okay. So this is patient who has recently been treated for her knees. She's now walking up and down.
No está inflamado tampoco.
She said it's not swollen, but
It's not no more fluid.
no.
Okay. And the pain, and she can pick the legs up.
Dolor? Nothing.
Nothing. Nothing. Now we wonderful. And this is the completion of your treatment. You've had 5, right? Or
Right.
5 treatments. Okay. Wonderful.